Hey guys, if you're not able to watch my long form content of podcast, here are some short form clips for you to enjoy. Doc, somebody asked us how to reduce creatinine levels in a diabetic patient. I have two sub questions there. What is creatinine and who is diabetic?
Okay, so diabetes is the easy answer.
Okay.
Where you have like increased glucose levels, your pancreas insulin regulation is not happening. Creatinine is a measurement of your kidney function. The only way that we can find your kidney is working or not is a blood test.
Okay.
If we shut down all the blood tests in the world, there is no way that we can find your kidney is damaged or not until it turns advanced. So creatinine is a basic essential thing. So why are we talking about diabetes and creatinine is diabetes on a long-term effect, it causes end organ damage, which is including kidney. So we call that as diabetic nephropathy, where because of the uncontrolled diabetes, the glucose levels have compromised the kidney function. And how do we know? The creatinine level will go up. And we know on the routine blood check when people do it for diabetes. And that's why patients with diabetes get routine blood checkup. They check their eyes, they check their foot, because eyes is because of end organ damage of the eyes. And foot, because the nerve supply to the foot gets compromised, where they will not even feel hot or cold. So they step on a floor, even with hot water, they will not be able to figure out, which means the glucose levels in the body is so high that it has compromised the function of the nerves. That's called diabetic neuropathy. When it damages the retina of the eyes, it's called diabetic retinopathy. And when it damages the kidneys, it's called diabetic nephropathy. And the last one is, I'm a gastroenterologist.
You know what I heard in all of that? I just saw a sugar molecule slapping me. Sugar slapping my eyes, sugar slapping my heart, sugar slapping my kidney. Is that what it's doing?
Pretty much high amounts of sugar, where you're not able to manage. Again, comes back to the long-term abuse of the body.
And so basically, I think, so when the person's asked us how to reduce creatinine levels in a diabetic patient.
Sorry, yeah. So the answer is decrease the glucose levels, kidney function will get better.
Do you think fasting would help?
Absolutely. Absolutely.
Have you had any crazy cases where, the blood tests are like of all these kidneys and liver and whatever blood markers you check? Like they're all crazy. And then you had a person change their diet and do fasting. And have you seen miracles in like very fast period?
Yeah, this fasting circadian rhythm is very close to my heart. So what I did was I started this weight loss program. It's called New Me.
New Me.
New Me.
Okay.
It's an online weight loss program where I figure out whether they are diabetic or not by a simple 35-year-old coming in, I need to lose weight. So we do some blood work, and then you will be surprised where the A1C level, which is the measurement of your diabetes, is sky high, like 11. And normal is around, like
And
5.
they don't even know that
They
they're
don't
diabetic.
even know, right? So then I said that, I sit with them in my clinical practice. That's what I do, and then I check with them in terms of, okay, let's start with your fasting regimen initially. We don't go like one meal a day, no severe fasting because of the insulin diabetes regulation is a little bit very tricky. Fasting works, but very carefully in diabetes along with the supervised regimen under a physician guidance.
So can I say that you truly are a doctor that prescribes fasting as a form of medical treatment also?
As a prescription,
Yeah.
very individualized. Very
Got it.
individualized. That's a key.
That's the key.
Yeah, I don't go extremes. At the same time, one plan is not for the same for everybody. I can say, okay, go for like 10 a.m. to 6 p.m. I don't think that's amazing.
Okay. Doctor, this is a female asking this question. Due to PCOD tablets, polycystic ovarian disorder, I mean, you know that, but for those who are not aware outside, so women have this condition which affects their ovaries. They take a tablet. I'm not aware what the medication is. So she says, I'm not able to consume any proper food. Any suggestions?
So PCOS is not a disease. It is linked to your circadian rhythm. It's linked to your hormonal imbalance. Unfortunately, women are at a disadvantage compared to us because women have so many hormones to be balanced. Estrogen, progesterone, all we have is testosterone and we get away with it. And they go through so much hormonal changes every month. Can you imagine? Every cell is dying and then waking up again, generating again every month. They go through a lot. For them to have a good balanced hormones, their circadian rhythm has to be even on the top of the game. And the medication that she's talking about is metformin. What metformin does is it just tries to improve the sensitivity of the insulin, so the insulin works a little bit more so that the ovum follicles and everything can come out with good quality by collaborating with estrogen progesterone.
So, as a doctor, would you say that's one part of helping women along the PCOD journey or reducing it is weight loss?
Big time. Weight loss is not one part. That is the major part. If they lose weight, they will not be on any medications at all.
So, my mind is going 30,000 cycles a second because nowadays I'm getting a lot of teenagers, 18, 19, 20, 21-year-old girls coming into our nutrition clinic with PCOD condition. And could one of the prescriptions be, I need to get your body fat percentage down?
All your prescription should have it. That's a no-brainer. It has to be. I think the bottom line mechanism is because of this disturbance.
Now, she says she was not able to consume proper food. So, I don't know if teenagers or girls or ladies consume proper food all the time. But do you think that metformin can also blunt your appetite or affect you?
Metformin can influence your gastric
So,
disturbance.
as a gastro, you've seen people that take medication and it changes their
So
gut.
we usually saw diarrhea. People take metformin and then they just start having like more loose stools compared to before. So then we decrease the dosage, we adjust accordingly.
Okay. Somebody's asking, can we have tea or coffee once in a while? I feel gastric discomfort when I consume it regularly. My mother-in-law, she's a gynecologist. She's a South Indian Tambram. She loves her coffee.
Filter coffee.
This sounds like her right now. Please suggest whether I can drink it once in a blue moon.
No, absolutely. Provided if your stomach is okay with it.
So you can't, when you got a wound and it's hurting you, you can't go and dig into that wound. Is what you're saying, right?
But when you do all the other stuffs right, that wound will be healed, and you can go back to your routine.
So, are you saying that kind of dig a little bit deeper and see why you're facing a problem and don't blame tea or coffee? There could be other triggers.
That's what you want to tell your mother-in-law?
Yeah. My mental health affects my digestion. How can I fix it or improve it?
Sleep. Big time. Your mental
Sleep.
health and your digestion is linked with a common mechanism called sleep.
That's why you're talking about circadian, which is part of the sleep cycle and the wake up cycle.
Your body needs rest. We are just abusing it so much. Just slow down, take rest, make sure that you have 7 hours of quality sleep. Your body's hormones are so powerful than what you think.
I am predicting and I can see the future and I can see the present. I'm in Dr. Pal's consultancy clinic. He's writing on his prescription pad, less watching of Netflix. No binge watching of Netflix.
Correct.
Acidity will disappear. Gut-brain axis will improve.
Right. If you're watching Ryan's channel, it's okay.
But we're only 45 minutes.
Yeah.
And watches during the daytime, not at the night time.
Yeah, exactly.
We're children friendly. Hey guys, if you've enjoyed this clip, then click here and watch the full episode. And don't forget to subscribe because your body is the most expensive real estate and I'm your real estate agent.